my name is Maritza Pantoja and I'm going to be doing my sinus trigger. So I'm going to go ahead and grab my patient. Hello, so can you tell me your full name? And your date of birth?
6/1/93.
Okay, and any chance of pregnancy?
No.
Okay, and so what's going on?
I've been having some like sinus, facial pain.
Okay. So I'm going to have you wear this lead, but I'm not going to be putting on a gown on her since we're just doing the sinuses. And so this is just going to go behind you for now. Okay, so I'm going to have you step up here, and I'm going to get her in an RAO position. So go ahead and put your face flat right there. Perfect. There we go. So I'm just going to move her back a little bit. Okay, so my central ray is ½ inch to an inch posterior to the outer canthus, and my inner pupillary line is perpendicular to the IR. So I'm going to go ahead and put my right marker since she's in an RAO position. Okay. And my collimation looks good. It's just a little bit above the glabella and then a little bit below the acanthion, like where her lips are. Okay. And her IOML is also perpendicular to the front edge of the IR, and the mid-sagittal plane is parallel to the IR. If we weren't using DR, I would use an 8x10, and my SID is at 40 inches. So I'm going to use a technique of 70 at 4. Take in a deep breath and hold it, or just hold your breath. And X-ray, you can go ahead and relax. Okay, so next we're going to do the Codwell. So for this one, you're going to face this way. Okay. So my mid-sagittal plane is perpendicular, and it's going to exit the nasion. So I'm just going to have her forehead and nose touching for now, and then I'm just going to bring her head back so her nose is touching and it forms a 15-degree angle. Okay, so, and then put my left marker. Okay, so yeah, my OML is 15 degrees, so it's 15-degree angle with the OML, and so I'm going to use a technique of 70 at 10. So hold your breath, X-ray. Okay, go ahead and relax. Okay, so next I'm going to be doing the waters. And this one, I'm going to actually have her chin touching the board here, so get as close as you can. And my MML is going to be perpendicular to the IR. And then it's going to form a 37 degree angle with the OML. Okay, so that looks good. And my mid-sagittal plane is perpendicular to the IR. Okay, so I am going to use a technique of 70 at 12.5. So hold your breath, X-ray, go ahead and relax. Okay. So next I'm going to be doing my SMV. So I'm actually going to pull up a chair here. Okay, and then you can actually switch that around. Okay, so I'm going to have you have a seat here. Careful there. And I'm going to bring that down. You can close your eyes for now. I'm gonna have her bring her head all the way back. Okay, perfect. And then I'm actually gonna move you towards me. Perfect. Okay. So my light is 3/4 anterior to the EAM inches, and then my central ray is perpendicular to the IOML. Okay, and I have my left marker over there. Okay, that looks good. I see her eyelashes up here. Okay. So yeah, my mid-sagittal plane is perpendicular to the IR. My IOML is perpendicular to the IR, and her mouth should be kept closed. And I'm going to use a technique of 70 at 16. Okay, so hold your breath. X-ray. Okay, you go ahead and relax. And that is my sinus trigger. So now I'm going to do my evaluation criteria for the sinuses. So I'm going to start off with my lateral sinus. So we're just checking to make sure we have all 4 sinuses visible. The sphenoidal sinus is the best demonstrated. So this is our frontal, our ethmoid, and then our sphenoid sinus, and then our maxillary sinus. And then we want to check that there is no rotation, and you can check because you can see the sella turcica in profile, and then the orbital roofs are superimposed and the mandibular rami is superimposed. Next, I'm going to talk about the PA-Caldwell sinuses. So we're looking for the frontal sinus, and then the ethmoid sinus. And then also we're making sure that our petrous ridges are in lower 1/3 of the orbit. And just make sure that there is no rotation. Our next image is the parieto-acanthial projection, Waters method. And this is for the maxillary sinuses. So we have them here. We're also checking to make sure that our petrous ridges are below the maxillary sinus and that there is no rotation. Next, I'm going to talk about the SNV sinus, and this is for the ethmoidal and sphenoidal sinuses. We have our ethmoidal sinuses here, our sphenoidal sinuses here, and then our petrous ridges are anterior to the mandibular condyles, and you can see that there is no rotation in this image.